Hello, my name is Dr. Julian De Silva. I'm a London-based facial, cosmetic and plastic surgeon, and I recorded this animation video to give my patients further information on what happens in the appointment 1 week after having rhinoplasty. And the aim of this video is really to give you general information. Of course, every individual patient has individual treatment and individual management may vary, but this is really to give you an overview of this appointment. So what exactly happens in the 1 week appointment after rhinoplasty? Well, firstly your cast is removed, then if you have stitches, these are removed. I personally suction my patients' noses so that you breathe better after the appointment. I also use anti-inflammatory medicine that will help reduce the swelling and speed up healing. And finally, I give clear instructions to all my patients on how to tape your nose after rhinoplasty in order to reduce the swelling faster. In terms of removing the cast after rhinoplasty, well, the cast plays an important function in that it protects your nose. It reduces swelling. However, after 1 week, this is really the right time to take it off, and sometimes at 1 week it really can be quite irritable or itchy. Now, in terms of taking the cast off, well, generally this takes 2 to 3 minutes in order to remove the cast off, and it can cause minor discomfort. Sometimes it can be more stuck down and it can take a little longer, but generally for most patients it's a relatively comfortable procedure. For some patients there may be stitches that remain after rhinoplasty, and removing these stitches is usually done 1 week after surgery. And a number of my patients are often concerned, is there going to be pain or discomfort in removing these stitches? In terms of removing these stitches, I take special measures. I use extremely fine dissolvable stitches which only need to be trimmed after surgery. And so although this is a very sensitive part of the nose, for most people, the general level of discomfort when I ask patients is a score of 3 out of 10. Now, it's fair to say that every single patient is different when it comes to sensitivity, and for some people it can be more sensitive. However, for the great majority of people, taking the right precautions and using fine stitches, for most people the level of discomfort is relatively small, and generally the length of time it takes to take the stitches out is approximately 2-3 minutes. For my patients, I like patients to breathe as best they can after surgery, and so at 1 week after the surgery I personally suction all loose debris out of your nose, and almost all patients will breathe significantly better once that is completed. This can be important because 1 week after the surgery it's very important that you don't blow your nose for 1 further week. And so to help reduce feelings of congestion, I often suction my patient's nose so you can breathe better immediately after your appointment. Suctioning your nose or hoovering your nose, well, it certainly is the most pleasant feeling in the world, but because you'll breathe better after doing this, it generally is a worthwhile thing to complete. All patients have some degree of swelling after surgery, as this is a normal part of healing. I personally prefer to give patients some anti-swelling medicine 1 week after surgery, as this will speed up the resolution of the swelling and essentially speed up healing. The only way to do this is introduce some anti-inflammatory medicine into the nose with a fine injection. And usually the nose is still relatively numb at this point in time, so most patients may feel a little bit of pressure or tension just for like a period of about 10 seconds, and then this is complete. Many patients feel very little at all because of this numbness. And on average, when I ask patients what level of discomfort patients have, most patients give a score of approximately 3 out of 10. However, the anti-inflammatory medicines does speed up healing, and particularly for patients with thicker ethnic skin will definitely give a faster healing and better result in terms of more definition in the nose. To help reduce the swelling faster, I give all my patients instructions on how to tape your nose at night when you sleep, at least for the first month. And what this taping will do, well, it puts a little bit of pressure on the nose, helps reduce swelling, speeds up healing, And particularly with patients with either thicker skin or ethnic skin, well, it speeds up the resolution of the swelling, which tends to be more associated with the skin type, and also it can give a better result as it gives more definition as a result of the fine pressure. I give patients the tape in which to use, and this tape is a special tape in that it's hypoallergenic, which means that it's very rare to have issues with the tape itself. It's also latex free, and this tape, what it will do is do the equivalent of put a little bit of pressure on your nose when healing to help enhance recovery and speed up the final result. The way to apply this tape is to have the tape coming down your forehead, down the bridge of the nose, round the tip of the nose, then back up the other side of the bridge of your nose onto your forehead. The tape can then be pressed down so it is relatively firm, and it can stay over this area overnight. And there's certainly no reason to use the tape during the day, as that will limit all your activities, but using it last thing at night and while you sleep means that in the morning there'll be less swelling in your nose than otherwise. I would encourage most patients to do this for the first month to speed up healing. So in summary, well, we've talked about what happens at the first week appointment, and really these can be summarized as removing the cast, removing the stitches as necessary, suctioning your nose to improve the breathing after rhinoplasty, the use of anti-inflammatory medicine that could speed up the reduction of swelling and get you to the final result faster, and also how to tape your nose to reduce swelling, particularly first thing in the morning.